In this lecture, we're going to learn about how hearing works, how sound waves from the environment come in through our outer ear, are channeled into our middle ear, and ultimately transduction happens within our inner ear so that we can actually hear sound. Just like with vision, sound travels in waves, and the physical wave properties of sound waves are going to change our psychological experience of them. The amplitude of a sound wave is going to determine the volume, and then the frequency of a sound wave is going to determine pitch. If we're dealing with a low pitch noise, that means that it has a wider wavelength, a larger wavelength. So a low pitch is going to be low frequency, and then a high pitch noise is going to be high frequency. So I moved that image so you could see it, just again demonstrating how wavelength is going to change the frequency or the rate at which a wave travels, and the frequency is going to determine the pitch. So kind of how high or how low a tone is. Now, the way that sound works is based on a mechanical chain reaction where sound waves are going to first be funneled into your ear canal by this cartilage protrusion from the side of your head called a pinna. And so your pinna exists to really capture sound waves and start moving them inwards into the ear canal. And you can hear how your pinna work if you first increase the surface area of your pinna. Noise should sound a little louder. If you then stop your pinna from capturing noise whatsoever, then noises are going to sound muffled. So your pinna are structured so that they can physically capture sound waves and start funneling them inwards. Once sound waves have been funneled inwards, they're going to ultimately start vibrating this stretch skin known as the eardrum. Your eardrum is a flap of skin that's stretched over the opening to your middle ear, and it vibrates in response to sound waves. And so we're going to see these vibrations, which first start at the eardrum, just being passed along across a bunch of different structures within your ear. So your eardrum starts to vibrate. That then passes the vibrations through your middle ear, which is made up of three tiny little bones known as the hammer, the anvil, and the stirrup. These collectively are known as your ossicles. Sometimes you might hear them called your tympani, but they're tiny little bones whose job is to take these vibrations, really capture them, and pass them along ultimately to be passed through the oval window into what we call your cochlea. So the stirrup here is attached to the oval window. Oval window is a membrane into the cochlea, and so the vibration is passed through the oval window into the cochlea. The cochlea is super important. The cochlea is to hearing as the retina is to vision, meaning this is where transduction is finally going to happen. So if we zoom in on the cochlea and kind of look at what its definition is, it's going to be first just described as this coiled, bony, fluid-filled tube. If you look back at this diagram, we're looking at the outside of the cochlea, but in 3 dimensions, your cochlea is coiled in on itself, and it's full of fluid. Inside the cochlea, what the fluid does is it starts to vibrate in response to these sound waves and trigger neural activation. So sound waves are going to be transformed into neural information within the cochlea. This is just a simple cross-section of what the inside of your cochlea looks like. For the sake of an introductory psych course, we don't need to know all of these different structures. What I really want you to focus on is how you have the oval window here where the stirrup's going to be passing sound waves. The inside is full of all of that fluid. And then I've added in this red line here just to demonstrate that there's an inner lining inside your cochlea, which is known as the basilar membrane. And the basilar membrane is really important because as the fluid starts to move inside the cochlea, the basilar membrane starts to vibrate. And it starts to move back and forth. And that's important because the basilar membrane is lined with what we call hair cells. And those hair cells are going to ultimately produce neural information. When they are activated, when they move, what they do is they then send a message, they kick a message out to adjacent nerve cells. And just to clarify on this slide, I think my grammar might have gotten a little tricky, but I'm saying that the movement of the basilar membrane is going to trigger the activation of these hair cells. And then ultimately, those hair cells are going to activate nerve cells that they are located next to. So here we just have an electron microscope image of what your hair cells might look like. And you can see they look like hair. They're little fibers, and they're lined with cilia. And so as the basilar membrane moves, those hair cells also start to move. I think of the inside of your cochlea sort of like the ocean floor lined with seaweed. As the waves go back and forth, the seaweed goes back and forth, and so too as the cochlear fluid moves back and forth, your hair cells move back and forth. And the movement and the motion of those hair cells is going to trigger a neural impulse, and that neural impulse is going to ultimately be taken out of your ear via the auditory nerve. Now, your hair cells can be damaged over time. The majority of hearing loss is actually due to damage to your hair cells. If you expose yourself to loud noises, whether it's a hazard of the job, maybe you work construction or you're in the military or you just like going to really loud concerts, the problem with that is that you can really damage your hair cells forever. There's an analogy I think that your textbook provides, which says your hair cells are sort of like the fibers on a carpet. And so at the beginning, when you have a brand new carpet, those fibers are really springy and they stand upright. And your hair cells, in the beginning, they should be nice and upright and springy, meaning that if they get vibrated and if they move, they can bend and trigger neural activation. Well, if you've been living in a house for a while, you have furniture on a carpet, and as you know, when you go to move that furniture, sometimes you'll notice the carpet fibers are now stuck just like bent over. And that can happen to your hair cells. Over time, if you keep blasting them with music or loud noise, they can get stuck, kind of bent over like this damaged image shows. And so then they can't respond correctly to incoming sound waves. So if you have experiences where your ears are ringing after exposure to loud music, that's a warning sign. It's your body's way of telling you, hey, you might be damaging your hair cells. You can't really expose yourself to music or to noise that's loud anymore. Now, how do we interpret volume? How do the physical properties of a wave allow us to hear volume? Well, we know the physical properties of the wave that are going to matter are going to be the amplitude. Amplitude is what's really important for volume. But then what does that mean at a structural level? Well, waves with a greater amount of amplitude are going to actually activate more hair cells. And so this is how we are able to experience high volume versus low volume. It's based on the number of activated hair cells as opposed to the intensity of any single one hair cell.